open.
Well, thank you, Mr. Speaker. And it's a pleasure to rise to speak to this bill tonight on Pharmacare. And I want to thank the member for New Westminster Burnaby for bringing it forward. I'm sure the reason he's bringing it forward is to call for action, because there's been a lot of talk about Pharmacare, but to be fair, there's not been a lot of action. And as a way of background, the Liberals have been talking about Pharmacare since 1992. But they've been studying and studying and studying and talking, and there hasn't really been anything concrete come forward. And so I'm glad to see that we're talking about this tonight. Now, as way of why you might want to pay some heed to my commentary, as the former shadow health minister, I was on the health committee when we studied Pharmacare. So certainly we've heard from all kinds of testimony from every province and territory in the country, from all sorts of Canadians on what they think, and related topics like the drug approval process and rare disease medications, which also are important and need to be addressed. And so I think what is true is that all parties in the House are looking for a common outcome. We all want to see that Canadians have access to prescription medications. I think the discussion is about what is the best route to get there. And for this bill, we know that it's proposing to take provincial coverage and put everybody on it, essentially. That may be an oversimplification, but that's what it is. Now, if we look at the situation today, we know that about between 95 and 98% of Canadians have prescription drug coverage, depending on which report you're looking at and depending on the types of coverage. So many people have got private plans, and the private plans that they have cover typically more than 14,000 medications, compared to the public plans that cover 4,000 to 5,000 medications. The private plans cover, in addition to the medications, many services. People are getting physiotherapy, orthotics, various and sundry, with their plans. And so there are not a lot of people that have a private plan in the country that want to give up the private plan to go on a public plan that would have less coverage. So that's certainly one issue. Now, most provinces actually have a plan that covers people. There are some exceptions. So, for example, in Ontario, if you're under 24, you get coverage. If you're over 65, you get coverage. If you're on social assistance, you get coverage. But otherwise, unless you have a private plan, there is no coverage. So there are some gaps there. The other gap happens in the Atlantic provinces. And in some cases, there's a plan there, but because the list of approved drugs is small, many people cannot get coverage for the particular drug that they're taking. And this brings up an important consideration when we talk about this bill, because the member in the bill talks about, from the Canada Health Act, the requirements of accessibility and universality. And if we talk about universality, it's difficult to have that in the different provinces when each province has a different list of the drugs that are covered. And so this is called a formulary. And what I would suggest is that today we actually have some Canadians moving between provinces to get coverage for the medication that they need that's not covered in the province that they are currently in. And that's a situation that through consultation, I think, and discussion with the provinces and territories, we could come to a more common list of medications that will be covered. And I think that would go a long way. Now, many people that don't have coverage may not be aware that they have access to a provincial plan. So there is an opportunity to increase awareness in that way. And I think that is something that should be done. Now, in terms of the cost of one of these systems, the cost of transferring and putting everybody on the provincial plans has been estimated. The Liberal proposition was actually for a single payer federal system of Pharmacare, and the Parliamentary Budget Officer had costed that at about $20 billion a year, but they underestimated some of the costs of prescription drugs that we were paying by about another 20 billion. So, looking at about 40 billion a year for that. And I think there was a lot of resistance in the public to that idea, because we've seen when the federal government tries to implement things, if we take, for example, the Canada Revenue Agency that has a 30% error rate in terms of the advice they're giving to people and are not always friendly on the phone, I would say that people wouldn't necessarily want their prescription medications administered in that kind of a system. But people are fairly happy with the provincial systems, and so filling the gaps that way is one option. There are other options that could be considered, and I certainly think it's worthwhile thinking about it, because C.D. Howe published a report that said if you put the people that don't have coverage on the existing provincial plans, the cost would be about $2.2 billion a year. And so that would be reasonable. For that similar cost, I would tell you that as an engineer, when I was a contractor, I had to buy my own benefits. And for $1,200 a year, I could not only have prescription drug coverage, but I could have dental coverage and medical coverage. And so on a volume discount, if you took the 2 to 5% that don't have coverage and you add that up, that's about $2 billion a year. So there's an idea where people could go on the government benefits. So there's a lot of ways to approach this. And I think, the discussion needs to be, what is the way that makes the best use of taxpayer money and takes advantage of some of the systems that are already in place? Now, let me talk for a minute about rare disease medications, because, this proposal will do nothing to address some of the issues with respect to that. Today, to get coverage for rare disease medications, private insurance companies pool their money so that not any one company has to take the risk of these very expensive medications, some of them $250,000 a year, $1 million a year, very expensive. If the government infused money into that pool on the condition that everybody got their rare disease medications covered, that would be another great way to ensure that people do have coverage for some of the most difficult to cover drug costs. The access to medications also depends on making sure that drug companies want to market their drugs in Canada. And unfortunately, the Liberals have put changes to the drug approval process in place that will make the process longer and more costly. And as a result, many companies do not want to market their medications in Canada because we're a small population and, they would have to operate at a loss. This is also impacted on the number of clinical trials that are happening in Canada. And so I think that, the government needs to reconsider that poorly thought out policy, definitely. I think that if you look at some of the examples of innovation that's happening in the world, we've got Chile, that has a great funding model where they're infusing money into a rare disease fund, but also allowing people to buy government bonds that also kick into that fund. So there's a number of innovative ideas around the world that we should take a look at. So I look forward to working with my colleagues on this bill towards the common goal of, getting prescription medication access for all Canadians. There are a number of things that could happen to our benefit out of this. We would have better volume leverage. We could reduce the cost of drugs that way, take away some of the co-payer issues that provide barriers. And I look forward to discussing all of these things with my colleagues when this comes to committee. Thank you.
Thank you very much, Mr. Speaker. I appreciate the opportunity to share my thoughts on this very important bill. It is an immense honor for me to be able to take the mic right now and to speak to my colleagues. Bill, I want to thank my colleague from New Westminster, Burnaby, for bringing this forward. This is an opportunity, a very special opportunity that we have right now to make a massive difference in the lives of Canadians. That we have seen millions of Canadians lose their jobs. And when they lost their jobs, they also lost their benefits. That means millions of Canadians were not able to purchase the medication that they needed. This is on top of the already millions of Canadians that simply cannot afford their medication, whether they don't have coverage at all or have coverage that costs too much. There are so many Canadians that are not taking the medication that they need because they simply can't afford to. I've spoken to so many families, so many people that tell me of the pain of not being able to afford their medication. I think of a family where the father works in construction and he's got a heart illness that requires him to take medication to stay healthy, but he can't afford that medication. On top of it, his children need medication. And so he's got to choose between not only paying the bills and buying his medication, but also between buying the medication for himself or for his children that he loves. That is an impossible position to be in. And he's not alone. There are so many families that make the same decision. We know that 1 in 5 Canadians are not taking their medication simply because they can't afford to. We know that when you can't treat an illness, you end up at the worst stage of that illness, and it costs the system, it costs the family, it costs the person so much more. Having universal access to medication so that everyone in our country could afford medication would dramatically improve the lives for everyone. The Liberals have been promising universal Pharmacare for 23 years. They promised again in 2019. But have people seen any difference in their lives when it comes to accessing medication? No. What we've seen again and again is that this Liberal government sadly sides with the pharmaceutical industry instead of with Canadians desperate to stay healthy and afford their medication. So we have a concrete solution. The solution is, let's use the combined power of our entire nation and use that to negotiate better prices so that everyone in our country can afford medication. This is so important. This is an opportunity to save lives. So I'm asking everybody to think about the millions of Canadians who can't afford medication, to think about our healthcare system that allows you to go to a doctor and get diagnosed for an illness, but not be able to afford the medication you need to stay healthy. To think about a healthcare system that is the only one in the world that provides universal health care that does not include medication coverage, and to pick up your phone and call your local MP. Sign petitions, write letters. We have a week left. This vote on the first step to establish the first of its kind free medication coverage for all Canadians is next week. And we can put pressure, we can show that this is the way forward, and we can win. People have shown the power of organizing. They've shown again and again, when people come together, we fight and we win. Once implemented, the idea of having medication coverage for all Canadians, that no one in our country would have to worry about paying for their medication, that if you need medication in this country, you use your health card, not your credit card. That dream can be a reality. And in doing so, once implemented, it would establish a savings of at least $4.2 billion that could be reinvested into our healthcare system. Here is an opportunity for the Liberal government to back up their words. Their own commission, their own report states that one of the key steps to establishing a universal public medication for all system is to pass a Pharmacare Act like what we proposed. It is far past time to pass and deliver universal Pharmacare to Canadians. Let's get it done now. Merci.